Hello, this is Dr. Kent Holtorf from Holtorf Medical Group. I'm about to undergo a high-dose ozone, also known as the 10-pass ozone. So basically, ozone works a number of different ways. It not only basically breaks down to oxygen and water, so you're going to oxygenate the tissues at much higher level, which is great for killing Lyme, other bacteria, viruses, but it also modulates the immune system. So especially with Lyme, you get basically not low immunity, not high immunity, but a dysfunctional immune system. And you have two sides of your immune system, Th1 and Th2. Th1 gets stuff inside the cell, Th2 outside the cell. Now what Lyme does is, with the Th2 immunity, it's very inefficient. It doesn't work very well at killing intracellular infections. So Lyme has developed a trick to drive your immune system into Th2 dominant, and then it switches to intracellular form from its cell wall that's outside the cells to a non-cell wall form inside the cells, and then it effectively escapes the body's immune system. So if you can bring that basically Th2 down, which is causing your symptoms and the inflammation and the achiness and cognitive dysfunction, but increase your Th1, which is the good immune system that can actually effectively kill an intracellular organism, that's where you're going to get benefit from treatment and be able to eradicate the infection. So that's one of the mechanisms that ozone works through, and ozone effective against especially intracellular bacteria and viruses. So that's what we're going to be doing. Standard ozone's great. With the high dose, it's just so much better. And oftentimes we'll have people feeling better during the infusion. So it's a great addition to the multi-system treatment of Lyme. Okay, so as you notice here, we're letting the blood drain, and we'll do multiple passes in that blood will drain out. We can do between 200, 400, 500 cc's of blood. Then we'll generally add twice as much ozone to that. Now, this is not hyperbaric, and hyperbaric sounds wonderful. You think of hyperbaric oxygen, right? So you're totally enclosed in a hyperbaric chamber, so all your cells get an increased pressure of oxygen. Now, the hyperbaric ozone machine does not work like that. It just is hyperbaric up until, as soon as it goes in your body, it's not hyperbaric. So you don't get that hyperbaric oxygen. What it's really designed to do is get you that amount of ozone in the shortest period of time. However, because of the safety requirements of hyperbaric, if you were to not have a safety valve, all of a sudden pumping a large dose of ozone certainly could be dangerous. So there's a lot of safety valves, and most places will have the doctor do it. And the problem with that is generally cost. So the machine tries to speed up the delivery of it, but it will take an hour and a half, 2 hours most of the time. So I don't know anyone doing it for, I think the lowest price I've seen is about $900. Most people are between $900 and $1,500. Now, we're able to do this in a much more cost-effective manner, and to do a 10-pass, it's around $400, $450 to do a 10-pass in this way. And it takes about the same amount of time. Again, same benefit, because with hyperbaric, sounds more sophisticated, but it's really just trying to deliver it faster. And basically do it this way. You get almost the same speed because we can put more in a bag than will fit in a hyperbaric bottle that will only hold about 200 cc's. So again, same effect, but just more cost effective. So people wonder, okay, what am I going to feel during this? What after? What about side effects? And in terms of effectiveness, it's variable. Some people, again, as I mentioned, during the treatment, they're feeling so much better. And these are even people that have been through numerous treatments. Other times it's variable. You may need one treatment. You may need multiple treatments to get an effect. Typically, we start low. We don't go right to 10-pass because it can basically, from die-off, get what's called a Herxheimer effect, which is die-off. You get increased cytokines production, inflammation. from that die-off. So we start lower, basically 1 pass, go up to 2, 4, 6, 8, 10, and work up to that. So we typically can prevent, and some people can go up higher, faster, other people not so much. And depends on the stage of the Lyme disease that you're in, the total body burden, what kind of species, what kind of co-infections, all those are variable. Are you very super sensitive? Are you like a multiple chemical sensitivity person? Again, those people will generally need to go slower. Now, also is what about die-off the next day? Again, you can have certainly a Herxheimer for a couple hours or even a couple days, but we typically have ways to mitigate that, including even some herbal products that kind of help with detox and anything that helps that immune modulation and keeps that Th2 from going too high when the body's killing an infection. Glutathione, very effective, low-dose naltrexone, some of the peptides like thymosin beta-4, really reducing inflammation. Inflamapep is a great treatment, a peptide that's really lowering, again, that Th2. So we use peptides to basically target the different parts of the immune system so we can get that perfect balance of increasing Th1 and lowering Th2. So even like Myers cocktail and other IV treatments and other oral treatments to reduce the side effects. And we're finding actually in your body actually will build up, one of the best things about ozone is that you get this surge of antioxidants after. And so that actually helps you basically tolerate and less side effects for the subsequent treatments. So generally very well tolerated the way that we do it. Again, with any effective treatment, there is a risk for side effects, in terms of feeling better, worse before you feel better. But those we generally monitor and are within reason. There are some limitations to doing ozone. You do need a fairly decent vein size to allow the blood to come out. But the nice thing is with doing it this way, it doesn't wreck the veins. Now, you can also do direct ozone, which we find is effective as well, but it tends to possibly irritate the veins, and especially if you have small veins, that you don't want to wreck them over time. Where anything like, or high dose vitamin C, very hard on the veins. So a lot of IVs are hard on veins, but this is actually because you're taking the blood out, mixing the ozone with it, it actually will basically prevent any irritation in the vein. That is generally not a problem at all in terms of any pain or any irritation of the vein.